I'm Alice Taylor. I moved to Curry County in the early 1970s. I was a young nurse, and shortly after I became involved in childbearing and midwifery, and I started my midwifery practice in 1978.
Hi, I'm Dr. John Rush. I'm an eye doctor, and I've lived in Curry County for 37 years.
I'm Dr. Williams. My practice is family practice and general surgery. I came here in '71. I guess that's 37 years here in Gold Beach.
I can't imagine, for me, a better place to practice. I love the county as a community, so I have been able to care for people through generations.
When you do something, you can see the immediate rewards in it. It's a much more interpersonal. You get to know your patients, not just as patients, but as friends and as people in the community.
Well, we have a skewed population here that is a little bit more the elderly, so we have plenty of health care. In other words, economically, there's plenty to do.
I think we're lucky. We have a lot of elderly folks here. They're on Medicare. They have supplemental insurance, private insurance companies, which do just fine with.
We do not have managed care in Curry County, which many providers in other areas are quite envious of.
But we're really pretty much a fee-for-service county now, and I think that's more satisfying for patients and providers.
One of the questions that any doctor asks is, how is it to work with a community hospital like the Curry General Hospital that we have here?
Curry General Hospital is another home. My husband is like another home for us. My husband's a physician, and the kids come in to visit him in the doctor's lounge when he's on call, or pass by the ER and see him busy, while they keep on going to the cafeteria. Well, the food is wonderful there.
We have a fabulous staff of nurses. We have an incredibly fine hospital administrator and a good hospital board that are all supportive, and the community is behind it all the time. The community is the insurance that this hospital will survive throughout, and it has proven that over the years many, many times. Great staff, great doctors, great community, it all fits, and it's here to take care of us.
Patients expect quality care. They do not expect their care to be limited in any way by resources that are not state-of-the-art. We practice in a way that reflects current standards of care, and state-of-the-art equipment is needed to do that.
We have done nearly 4,000 cataract surgeries here in this hospital, and incredibly supportive staff. Patients are very happy. We can have the state-of-the-art surgical program here. It doesn't have to be only done in a larger city. It's all about the doctors and what they put together.
The other rewarding part of this community is you don't have a lot of infighting amongst healthcare professionals like you do in other places. We're all different. We're all different characters, but we're all here for the same mission, and that's healthcare.
The medical community is a family. Many of us have been practicing here for quite a number of years.
Doctors throughout this community get along extremely well. There's no backbiting, there is no political interaction that creates a lot of the things that you see in major hospitals and major cities. And one fundamental reason for that is because there's plenty of patients to go around.
Collaboration is a key word here. The providers know and are even articulate that we have to work together because we do have the unique challenges of practicing in an isolated area. There is mutual support, shared call, so nobody is on call all the time or does not have an opportunity to get away or take a break.
People have competition and they think, oh boy, that's my competition. But then they discover that the more you collaborate, the more successful everyone is.
We have a high level of respect for each other and cooperation. Cooperation is the key.
The issues of being on call can be a real disaster in a large city where you've got to travel a great distance to see that patient, get to a hospital or whatever. But here in 5 minutes, you can be at the hospital, see your patient.
No one here takes an 8 to 4 attitude. If the doctor's, it's 5 and there's an emergency, he's here. And if that doctor needs help, help is here. And I think if you take that attitude and you work that way, it works.